So as well as the national optimal lung cancer pathway, there are of course other things that we can do which will improve lung cancer management. And one of the important things is to get the right patients referred into the service at the right time. And at the moment, the NICE guidance on referral for lung cancer is a bit woolly, and it's woolly by necessity. What we really need is much more accurate tools for the GPs to use, so that when a patient comes through the door and they think they might have lung cancer, they can much more accurately assess their risk. And then they can decide whether the person's high enough risk just to go straight into a CT scanner, into secondary care, or whether they need a chest x-ray and other management before they might refer them. That means we won't over-refer people, but we also don't miss those people at relatively high risk that actually need referring. And I think we can improve that management massively by making sure we get these risk tools. That's more of a research element at the moment, but it's something that I regard as really quite important, and it supports the national optimal pathway. In terms of other things that we can do, we can around the national optimal pathway, but the crucial thing is that we know there's massive variation across the whole of the country. So depending on where you're first referred for your lung cancer will determine whether you get treatment and how well you do with that treatment. And the problem here is that we have a distribution of expertise which tends to be concentrated in the centres, the big hubs. And that's good. It's great to have these fantastic super centres, but the problem is that 70% of people with lung cancer are first referred out with a big hub, so to the smaller units. So this is where the commissioning guidance that we've developed for lung cancer comes in. That tells commissioners how to commission services which essentially provide the same level of expertise at the units that's available at the centre. And that's a real challenge. At the moment it's not really on people's radar. In a couple of years' time it will be very much on their radar, and they'll be trying to implement this, and it will be a real challenge. But again, this will really improve things, I think, for cancer patients.